Hi, I'm Kristen Burt for LifeScript.com. What is Crohn's disease? Cedars-Sinai's Dr. Gil Melmed breaks down what patients need to know and how they should approach treating their disease.
To understand Crohn's disease, one really needs to understand the immune system of the body, because really that's where we think about Crohn's emerging from. Our immune system, particularly in the intestines, is designed to interact with the environment. And normally, when we have a foreign invader like food poisoning or something like that, our immune system gets activated. We get sick, diarrhea, abdominal pain, maybe some vomiting, and then the immune system quiets down on its own, and we feel better. With Crohn's disease, that mechanism for normalizing and turning itself off after some trigger has turned it on is not working properly. And so people with Crohn's disease will have ongoing inflammation as a result of the immune system being activated indefinitely.
And when a patient comes in and is diagnosed, what is the course of treatment? Is everyone individualized, or is it something that there's kind of a one-size-fits-all?
Yeah, Crohn's disease is definitely not a one-size-fits-all disease. There are several manifestations of Crohn's disease that may occur in different patients, starting from symptoms. Some people may have diarrhea, others may have abdominal pain, weight loss. Some people don't even have any GI symptoms, and we happen to incidentally find it, for example, in a child who's just not growing right. And so there's a whole bunch of different potential manifestations of the disease. In addition, the course of Crohn's disease can be different in different people. Some people, it's mild and stays mild forever. In others, and unfortunately in the majority of people, when Crohn's is not adequately treated, then it can progress towards complications. And those complications are a result of ongoing inflammation that can lead to narrowing of the bowel, blockages of the bowel, and other complications that can ultimately require surgery. And unfortunately, surgery is common in people who have Crohn's disease.
We just were interviewing Larry Nance Jr., and he was getting an infusion. What are these infusions doing for people with Crohn's disease?
So Larry Nance is getting a biologic drug, which is an anti-TNF drug. It blocks a specific component of the immune system called TNF-alpha, which is a chemical messenger that drives inflammation in different diseases. So Crohn's disease is one of those diseases. And by blocking that particular messenger with this drug, we can then limit the inflammation that's going on in the gut to enable that inflammation to subside, for him to then be able to absorb his nutrients, grow, which is what happened when he first started on this medication, and lead a normal life, which is what he's been able to do.
I have to ask, research dollars, are we going to see a cure in our lifetime?
I hope so. I hope so. We do a lot of research here, and actually Larry Nance consented today to be part of our IBD genetics registry. We do genetics research here, and there's a lot of research going on around the world. I mentioned the microbiome. I mentioned the genes that both are probably implicated and responsible somehow to set somebody up for developing Crohn's disease in the right environment, and maybe that environment includes diet. And so there's a lot of investigation that's going on. There's dozens of potential new therapies in the pipeline under development that will be better and safer than what we currently have available today. But ultimately, you're right, the question is, what about a cure? And I think once we unlock those secrets behind the genes, and the microbiome will be that much further along for a cure, which will probably be individualized, because those genes and the microbiome environment are different from person to person. And once we understand those a little bit better, I think we'll be able to be talking about a cure.
Fantastic. Well, thank you so much for your insight. I sure appreciate it.
Thank you.